60 seconds ago, the emergency broadcast system stayed silent. Instead, a push alert lit up 2.3 million California phones. Plan canceled. Formulary updated. Copay multiplied. No quake, no fire. Just a cloud server in Sacramento that repriced survival while Pacific waves hit the Santa Monica Pier. Dolores steps off the last Orange County bus at 1:05 a.m. She is 78 and spent 40 years picking strawberries in Ventura Fields. Tonight, she carries an inhaler that cost $9 yesterday and costs $319 tonight. The price changed at 12:01. Her lungs did not get the memo. She rattles the empty chamber. It sounds like dry seed pods shaking in a Central Valley wind. Around her, 4 other seniors stare at identical alerts inside the tinted glass of Union Station. Plan terminated. Coverage denied. Appeal deadline is 7 days. The hall smells of coffee gone cold and panic. No one speaks. Everyone calculates. Rent or respiration. Gas or heartbeat. The overnight Metrolink glides toward downtown Los Angeles, where the same insurer posts quarterly profits before sunrise. This is not a glitch. This is a looting operation wearing a spreadsheet mask, and it is already inside your medicine cabinet. In the next 4 minutes, you will learn how a kilobyte update can delete an entire block of generic insulin while you watch Pacific Sunset Reels. You will see why the biggest insurer in the state can legally change your drug list 30 days after you enroll. By sunrise tomorrow, 47 more seniors will be rushed to emergency rooms for skipping doses they can no longer afford. The math is simple. The moral math is obscene. One company reports record quarterly profits of $5.2 billion, while a retired farm worker gasps for air outside a locked pharmacy door in Bakersfield. Medicare Part D is not insurance in the way you think. It is a coupon book with moving barcodes printed in disappearing ink. The coupon can vanish between heartbeats. The barcode can triple while you sleep. California has 5.8 million Medicare beneficiaries. 3.4 million rely on Part D. That number sounds solid. It is not. Every plan hides a trapdoor called a formulary. The trapdoor opens 4 times a year. When it opens, your drug can fall from Tier 1 to specialty overnight. Preferred means cheap today. Non-preferred means expensive tomorrow. Removed means gone. The donut hole starts at $2,220 and ends at $5,550. Once you fall in, you pay 25% of a retail price the insurer sets. Last year, insulin retail jumped from $120 to $440. Seniors who budgeted a $9 copay woke up to a $155 bill. New for 2025, California insurers can move a drug to non-preferred with only 15 days notice, half the previous federal window. The result? 1,873 drugs switched tiers statewide last quarter, 62% landing in costlier categories. Translation: 1.1 million seniors saw at least one medication repriced overnight. Median Social Security in California is $1,833. Average Part D premium spike this year is 42%. Average rent in Fresno is $2,100. Subtract utilities. Subtract gas. Subtract the pill that stops a stroke. The remainder is negative. Negative means choosing between the pill that keeps you alive and the rent that keeps you housed. This is not about aging. This is about a system designed to fail at the exact moment people need it most. When the pharmacist says prior authorization is required, what they mean is we hope you live long enough for the facts. When the automated voice says appeal within 7 days, what it means is bring a lawyer and a calendar. When the letter says coverage terminated, what it means is goodbye. Behind every denial is a person counting pills on a kitchen table in Riverside, cutting tablets in half, skipping every 3rd dose, pretending dizziness is normal, pretending chest pain will pass, pretending the richest state in the richest country cannot keep abuelas alive. Domino. 1. System failure. Insurers auto-drop any drug that falls off the federal reference file. The file was updated at 12:01 a.m. on February 12th. 21 drugs vanished statewide. One was metformin. Metformin keeps diabetics out of comas. 61,000 Californians filled it last month. This month, the screen reads not covered. Data deep dive. The deleted list included 3 cardiovascular medications, 2 mental health stabilizers, and 1 oral chemotherapy tablet. Combined annual revenue for the drugs before deletion was $88 million. By removing them, the 3 largest PBMs raised first quarter earnings by 11%. Human case. Luis is age 71, a retired truck driver in Bakersfield. He takes 2 tablets of metformin a day. Yesterday the price was $9. Today the price is $249. He hands the pharmacist a roll of 20s and singles. It is $62 short. He walks out without the bottle. Outside, the heat already climbs past 90 degrees. Luis wipes his forehead with the receipt, then counts 13 strip mall pharmacies within view. Not one is in network anymore. The closest preferred store is a 40-mile round trip. Diesel in the Central Valley is $5.40 a gallon. He does the math. $10.80 in fuel to save $240 on pills that keep him alive. His weekly food budget is $35. The equation stalls. He starts the engine anyway. As he crosses the parking lot, his vision tunnels like looking through a paper straw. Sweat smells sweet. That is his blood sugar crashing. Moral takeaway. An algorithm pressed delete. A pancreas pressed panic. Domino 2. System failure. Plans erase entire zip codes from preferred networks. They call it geographic optimization. The translation is, we save money if poor people cannot find a door that opens. Rural Imperial County lost 52% of in-network pharmacies in 6 months. Urban Los Angeles County, population 10 million, lost 38%. The company line is patient concentration. The spreadsheet line is $47 million in bonus rebates from remaining high-volume chains. Data point, 409 independent pharmacies were cut loose in 90 days. The Central Valley lost 45% of in-network stores. Human case. Maria is age 73, a former farm worker in Salinas. She needs inhalers. The nearest preferred store is now 3 bus routes and 26 miles away. She has arthritis in both hips. She makes the trip once a month. The other 3 weeks she skips. On skip weeks, she parks outside the closed clinic at 6 a.m., window cracked, engine idling, sipping coffee to keep the cough down. Propane trucks rumble past. She times her breathing with their rhythm. Inhale 2 axles, exhale 4. A $300 rescue inhaler sits behind a counter she can no longer reach. Sensory detail. At the dusty bus stop, she leans on a cane that quivers like a divining rod. Each breath whistles through scarred lungs. Moral takeaway. Coverage on paper is not coverage on pavement. Domino 3. System failure. Pharmacy benefit managers reset accumulator funds every quarter. Translation. The $200 you already paid vanishes. Start over. Industry slide decks call this accumulator reset a member stewardship tool. Patient checking account ledgers call it theft. Across California, the reset hit 1.1 million seniors on the same morning, wiping out $423 million in previously paid deductible credits. Data point, 1 in 3 Part D plans in California reset on March 1st. Average senior loss, $412. Human case. Reverend James, age 84, Sacramento. A blood thinner keeps his heart ticking. From January through March, he paid $120 total. On April 1st, the register asked for $210. He hands over the money meant for the church food pantry. Sunday service attendance drops from 42 to 28 because the pantry shelves are half bare. The Reverend's sermon shortens to 15 minutes. Standing too long leaves him dizzy. He marks the offering tally on the same sheet he uses to track skipped doses. 2 pills sacrificed this week, 3 last week. That night, he preaches to 30 parishioners. His voice quivers like a candle in valley wind. He blames fatigue. The congregation blames age. Both are wrong. Moral takeaway. Faith can move mountains. It cannot move a copay. Domino 4. System failure. California allows insurers 90 days to decide an urgent appeal. Internal emails show one major carrier routes appeals through a Utah subcontractor staffed by 20 part-time nurses handling 600 cases each. Target quota, close 5 appeals per hour. Nurses receive a $75 bonus for every denial upheld. Data point, 14,600 appeals sit in queue. Average wait, 121 days. Mortality rate among pending cases, 1.8 times the state norm. Human case, Yvonne, age 77, retired teacher, Riverside. She needs cancer pills that cost $900 per month. Her appeal was filed January 1st. A denial arrived January 23. She died. January 20. The approval letter came January 25. Her daughter reads the letter aloud at the kitchen table, voice cracking. Outside, the desert wind rattles the aluminum screen door. The same door Yvonne would open each morning to greet the sunrise she no longer sees. Sensory detail. Her daughter finds the envelope under a hospice pamphlet. The paper is warm from the desert sun through the window. Moral takeaway. Justice delayed is breath denied. 4 dominoes, 1 conclusion. The system is not broken. It is programmed to discard people once their margins turn negative. Here is the math that matters. California spends $530 million a year on emergency room visits that could be prevented by taking prescribed drugs. The entire cost of fixing Medicare Part D for every senior in the state is $410 million. We save $120 million, and we save lives. Solution 1. State emergency price. Freeze. Washington state passed a 1-sentence law. No insurer can raise the price of a covered drug mid-contract year without state approval. The bill is 2 pages. It saved seniors $112 million in year 1. California can copy-paste votes in 30 days. Solution 2. Mobile pharmacy plus master lease lots. Sacramento funds a fleet of 15 vans that carry the top 200 generic drugs. Vans park at senior centers, churches, and public housing. A nurse practitioner writes the script on the spot. Cost per van, $1.1 million per year. Cost per patient served, $10 per month. Compare that to 1 ambulance ride for a stroke, $3,000. The vans already exist. They are sitting in a state surplus lot in Rancho Cordova with 28,000 miles on the odometer. Solution 3. Automatic appeals fast track. Any denial overturned by an administrative law judge within 30 days triggers a $1,000 penalty paid by the insurer to the patient. Overnight, the backlog disappears. In Oregon, the penalty is $500. The backlog dropped 92% in 6 months. California can double the fine and watch the appeals vanish. The roadmap is on the table.